Dysmenorrhea is a condition where patients experience excruciating pain during their menstruation. Menstruation occurs when the uterus sheds its endometrial lining once a month. Some pain, cramping, and discomfort during menstrual periods are normal. Excessive pain that causes you to miss work or school is not. The prevalence of dysmenorrhea worldwide ranges from 15.8% to 89.5%, with higher rates reported in adolescents population. If you have dysmenorrhea, a few simple home remedies and maybe some medication will fix the situation right up for you. So, no need to worry. Now, let's get started with today's video on dysmenorrhea in women. What is dysmenorrhea? In medical terms, dysmenorrhea means painful menstruation. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea occurs in people who experience pain before and during menstruation. It is thought to be caused by excessive levels of prostaglandins, a set of hormones that are responsible for your uterus contractions during menstruation and childbirth. If you had normal periods that became painful later in life, it may be secondary dysmenorrhea. A condition affecting the uterus or other pelvic organs such as endometriosis or uterine fibroids can cause this. What causes you to have painful periods? It's not always possible to identify the cause of painful periods. A hormone called prostaglandin triggers muscle contractions in your uterus that expels the lining. These contractions can cause pain and inflammation. The level of prostaglandin rises right before the menstruation begins. Painful menstrual periods can also be the result of an underlying medical condition such as premenstrual syndrome, PMS. PMS is a common condition that is caused by hormonal changes in the body occurring 1 to 2 weeks before menstruation begins. The symptoms typically go away after bleeding begins. Endometriosis. This is a painful medical condition in which cells from the lining of the uterus grow in other parts of the body, usually on the fallopian tubes, ovaries, or tissues lining the pelvis. Fibroids in the uterus. Fibroids are non-cancerous tumors that can put pressure on the uterus or cause abnormal menstruation and pain, though they often don't cause any symptoms. Pelvic inflammatory disease, PID. PID is an infection of the uterus, fallopian tubes, or ovaries, often caused by sexually transmitted bacteria that cause inflammation of the reproductive organs and pain. Adenomyosis. This is a rare condition in which the uterine lining grows into the muscular wall of the uterus, causing inflammation, pressure, and pain. It can also cause longer or heavier periods. Cervical stenosis. Cervical stenosis is a rare condition in which the cervix is so small or narrow that it slows menstrual flow, causing an increase of pressure inside the uterus that causes pain. Common symptoms to watch out for. If menstrual pain is interfering with your ability to perform basic tasks each month, it may be time to consult a physician about it. Talk to your doctor if you experience any of the following symptoms. At least 3 painful menstrual periods every year. Passing blood clots. Cramping accompanied by diarrhea and nausea. Fever, severe pelvic pain, sudden pain especially if you are pregnant, foul-smelling vaginal discharge. Sudden cramping or pelvic pain could be signs of infection. An untreated infection can cause scar tissue that damages the pelvic organs and may lead to infertility. Hence, urgent medical attention is required in these cases. Are you at risk? Some people are just at a higher risk of having painful periods. If you fall under the categories that we are going to mention right now, and if you're experiencing these symptoms too, then you might need to consider going to a doctor for a checkup. These risks include being under the age of 20, having a family history of painful periods, smoking, having heavy bleedings with periods, having irregular periods, never having had a baby, reaching puberty prematurely before the age of 11. Diagnosis of dysmenorrhea. When trying to find out what the underlying causes of painful periods are, your doctor will likely take your medical history and perform a physical exam. This will include a pelvic exam to check for any abnormalities in your reproductive system and to look for signs of infection. If your doctor thinks an underlying disorder is causing your symptoms, they may perform imaging tests. These can include an ultrasound, a CT scan, and MRI. Depending on the result of your imaging tests, your doctor may recommend a laparoscopy. This is a test in which the doctor makes a small incision in the abdomen into which they insert a fiber optic tube with a camera at the end to see inside your abdominal cavity. Treatment is available. At home, treatments can be very helpful in relieving painful menstrual periods. Types of things to try at home include using a heating pad on your pelvic area or back, massaging your abdomen, taking a warm bath, doing regular physical exercise, eating light, nutritious meals, practicing relaxation techniques or yoga, taking anti-inflammatory medications such as ibuprofen several days before you expect your period, taking vitamins and supplements. Dysmenorrhea is a very common condition in women of childbearing age, and especially in young girls below 20. You can easily subdue the symptoms with proper knowledge and some careful treatment. Now that you have an idea about this ailment, we are sure you will be able to seek medical help if that is needed. We hope you found this video informative and do recommend it to other friends. Thank you for watching. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos and subscribe to our channel. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe, stay healthy, and let your voice be heard.